Sure. Dr. Nick Blondin here from the Yale Cancer Center. We ran a phase 1 study of fb-PMT, which is a novel thyrointegrin inhibitor to treat patients with recurrent glioblastoma. The molecule fb-PMT, also known as NP751, is a thyrointegrin inhibitor targeting the alpha v beta 3 integrin, which is found overexpressed in glioblastoma tumors. By binding of the study drug fb-PMT to this integrin molecule, there's multiple downstream pathways affected by this, resulting in cancer cell apoptosis. And that was kind of the preclinical rationale for the development of this product. Sure. So we did a 3+3 type design of a phase 1 trial. We identified a starting dose of 0.08 milligrams per kilogram per day. Patients took the study treatment via subcutaneous injection that they self-administered daily. We treated 3 patients at each of the dose levels, again starting at 0.08 milligrams per kilogram per day. Was level 1. Level 2 was 0.24. 3 was 0.48. 4 was 0.96, and 5 was 1.44. We did an expansion at dose levels 4 and 5 to 6 patients total to further evaluate patients at those higher dose levels. We wanted to evaluate the safety and tolerability of the fb-PMT, and then evaluate pharmacokinetic profiling of the drug and establish the recommended phase 2 dose for this product. In a number of patients, we were also able to do some immunohistochemistry looking for the expression of alpha v beta 3 in patients. We looked at 14 samples and we found moderate to high expression of AV-B3 in 14 out of all 14 samples assessed. We found that the study drug was extremely well tolerated. In terms of safety analysis, there were no treatment-related serious adverse events reported. Again, it seemed remarkably well tolerated. There was no dose-limiting toxicities identified, and study treatment was well tolerated. In regards to the PK analysis, the drug had rapid absorption with peak concentration observed within 3 to 6 hours post-dose, and there was detectable plasma concentration persisting through 24 hours in many subjects. There was an expected correlate with the dose the patient received and drug level systemically. We found that patients in dose levels 4 and 5 again tolerated the drug really well, and particularly at dose level 4, 0.96 milligram per kilogram, patients stayed on study treatment for several months on average. And so we've identified this as the dose that we want to move into phase 2. We had 2 patients who were very long-term responders on study treatment with time on study 27 and 36 months respectively. So we are still trying to identify some other specific factors for those patients leading to those good outcomes. But with glioblastoma, particularly recurrent glioblastoma, having an average survival of less than 1 year, patients that are surviving 2 and 3 years, really we thought are extraordinary outcomes and support the further development of this product.